Victory Studios in downtown Little Rock, this is Capitol View.
Good morning. Welcome to Capitol View. I'm Roby Brock, your host. Our first guest this week has been on the show several times as Medicaid changes and policies to improve Arkansas's maternal health statistics have been front and center, but she's here with a different role today. She's Janet Mann. She was named by Governor Sarah Sanders as the new Secretary of the Department of Human Services. Congratulations and thanks.
Thank you.
For being here.
I'm happy to be here.
Yeah, awesome. You having fun in the new role yet?
Yeah.
Is it different than the old role?
It is different from the old role. I'm super excited to be Secretary, but changing from the Deputy and the Medicaid Director to the Secretary, now I have to be a little more higher up in transfer and delegate and ask people to say, hey, what's going on versus this is what we're going to get done. But I still get to say this is what we're going to get done, but it's just a little bit different.
Yeah.
So
what
nice.
Are you going to do differently than maybe your predecessor or predecessors? So do you have some thoughts on some different directions for something?
I do. I think first and foremost, we need to continue on some of the momentum that we had started with maternal health. We've moved into the implementation mode.
Yep.
We had a bill that the governor proposed and the legislature passed and she signed. So now we've moved into the implementation of maternal health and now taking those results as they come month by month and really seeing what's happening and driving future decisions. We're also going to still continue to focus on behavioral health, really with an emphasis on children and school-age children. But another piece of that that's very important is children before they go to school. Mm-hmm. So what can we do there? We have several pilots going and really want to use those evidence-based outcomes to really drive better decisions and better programs. In addition, work requirements. We've been working on it for several years. We have a pending waiver, and now we are into implementation and going live, and the team is working really hard given what was passed in the budget bill at Capitol Hill, signed by the president. We already had a pending waiver amendment requesting to do that, so now we will reconcile those two documents and then come forward with work requirements on or before January 1 of 27, which is the required deadline date.
So that's probably one of the biggest things from the budget bill that you'll be dealing with are these changes to Medicaid and the SNAP program. We're going to talk about both of those things eventually, but just what's going to be different about the work requirements this time that you think will make it more successful than it was last time?
I think the biggest piece is going to be the federal legislation that allows work requirements to exist. So we will be able to implement and have those work requirements, and then we will work with CMS on the terms and conditions of what those look like. But the budget bill calls for 20 hours a week or 80 hours a month, so we will be working on that. I think we're going to still use a lot of what we proposed with reporting of all types and then exceptions. So really want to focus on the ex parte, which is the administrative process of matching work requirements through electronic means, but make it easier for the beneficiary to report and know what they're doing. Yeah. We'll have to work out some details on the volunteering and caretaking piece of that, because we will have lots of data matches that we can use for people going to work, people going to school, and doing different things. And so we will work through those logistics on how we do reporting. Yeah. And then we also had a piece in our amendment that was different from the bill on success coaching. So if the beneficiary wants some additional guidance and help and how to move up and off of Medicaid onto hopefully what we employee-sponsored healthcare or further into the marketplace for healthcare, we will work on that piece probably as phase 2.
I don't have to tell you that you're going to be juggling a lot of balls in the air on not just those pieces of implementation from the federal bill and what state law is already making some changes for, but you've got skyrocketing health insurance premiums. There's a lot of uncertainty and turmoil in insurance markets right now, and that's going to affect Medicaid in a big way. How are you kind of preparing, adapting, knowing what's coming? I don't know if you can predict everything that's coming.
We
so.
can't predict everything, but we took steps in the last session with our home, our Medicaid expansion population, and we'll be seeking a new waiver with CMS that will be new on 1/1 of 27. And some of those ways to help with some of those skyrocketing costs and things is we worked with the carriers for pharmacy rebates to come back to the state and the federal government. We worked on the medical loss ratio, which really means they have to spend X percentage of what they're paid as a premium on medical claims. We are working with the carriers and the federal government to increase that to 85% so that more money is spent on healthcare claims to try to help that. And then a few other administrative things that we're looking at to handle what we know, but the unexpected, we will have to pivot when that occurs, because I can plan for so many things, but I can't plan for everything.
Yeah. So, I mean, let's you've heard the concerns from the healthcare community, the hospital community, the end user community about, these changes are going to have this effect. It's going to drive up more people not having insurance. They're going to go to the hospitals for uncompensated care. We've seen this happen in Arkansas before. We've seen it come down because of changes. What are the metrics you're going to be watching to kind of know what's working policy-wise? I mean, I know you can't go through every metric, but I mean, what are some big things that you're going to be watching that's going to give you some degree of certainty that something's working or something's not working? So
I think one of the biggest metrics we're going to watch is going to be our enrollment in the expansion population and in our regular traditional Medicaid. The one thing that I like about Arkansas is, with being an expansion state and having no gap in coverage, we're trying to keep uncompensated care low. So if we see a big drop in the expansion population, then what is happening? What is occurring? Is the economy growing? Is that a good thing? People are going to work, or is something else occurring that we are not aware of that we need to be mindful of? And we always have good relationships and good communication with our providers and our hospitals and others to talk about uncompensated care. But the big thing with the budget bill is two things I would just mention. Eligibility was not cut, so no eligibility changes, no changes in our FMAP, so we should...
What is FMAP for people that don't know?
The federal participation rate. Okay. So we get a nice chunk of change from the federal government with our Medicaid program. And then also we're going to have an opportunity that the state's going to receive up to about $500 million over 5 years on the Rural Transformation Health Care Fund. And so we are busy with different entities statewide and providers and others working on how to implement that. That'll be an application process that we don't have the guidance on yet, but we're already building the baseline of metrics and things. So really using that money to look at what we're going to do in rural Arkansas to help healthcare to hopefully mitigate some of the unknown and some of the known rising costs.
I suspect that even $100 million a year over 5 years is still not going to be enough to meet needs. So
probably not, but it gives us the ability to address some things that we wouldn't have had the ability to address. First and foremost.
Let's, in the minute and a half that we have left here, let's talk briefly about SNAPs. There are some reductions in SNAP benefits as a result of the budget bill, or is that the right characteristic for
so
this?
It's not necessarily in SNAP benefits, it's twofold. So we will see an increase in our administrative participation expenditures. I think it's about $20+ million a year, and I think that will take effect in future years. But what I think you're referring to is our error rate. So if we do not get our error rate
like
under
9%,
6%,
right.
We're actually closer to 7 right now.
All right.
So we've
looked at some older stats. So.
It was at 9, and we're working on getting it lowered. And if we can stay under 6, then we will not have to have as much of an increase in our benefit expenditures. Yeah. So that's the goal.
Can someone make it off of SNAP benefits? Can they provide for their family with SNAP benefits?
Yes and no. I mean, SNAP benefits are supposed to be supplemental. They're not supposed to be everything that is used for feeding their families, and so they will range based on your application and your income. So they will range from $187 a month through a much higher dollar amount, but they don't have to be spent every month. They can be accumulated and used for other things. But the biggest thing there is we've seen an increase in SNAP fraud across the country, and Arkansas has been hit with that. So we are trying to take some steps to reduce that, because I don't have a way to replace those benefits if they're stolen. And so we've taken some steps on SNAP fraud to try to reduce that, and we will continue to work on that.